Hi, I am making this video to say a big thank you to Dr. Premnath Garu. He's our speech therapist. And my brother-in-law underwent heart surgery, and following heart surgery during recovery, he developed brain stroke, and as a result of that, he lost movement. That means he got paralyzed in right leg and right hand, and he also lost the ability to speak. And we immediately started rehabilitation in the hospital, and then we continued rehabilitation at home after getting discharged from the hospital. And we started physiotherapy for hand and leg on the right side, and we also started speech therapy. So within 1 year, he regained movement in hand and leg. So they almost recovered. So we are happy, very happy with the physiotherapy he got, but we were absolutely disappointed with speech therapy. So we changed few speech therapists, and but what we observed is that all these speech therapists were just trying to make him pronounce letter by letter by repetitive practicing. And we were at some point of time wondering if speech therapy is all about making a person speak a single letter by letter. So, what is a great thing about being a speech therapist? So, anyone can do that. And we were kind of frustrated because there were no results even after continuous treatment for 1 year. And even our family and even the patient lost motivation to go through that speech therapy. So we felt that 1 year is too much of time, and then something special needs to be done to handle this case. So what I did after that is that I started searching in Google. So what is the problem? What is so special about doing speech therapy for patients of stroke? So I stumbled upon Dr. Premnath Garu's hospital and his history with previous patients, and I extensively studied the reviews from the patients he treated previously, and I understood that he is also specialized in treating adult patients, and this is a very rare form of specialty. And many of the speech therapists treat children where repetitive practicing improves their speech, but adults needed a slightly different therapy. So then I contacted him over phone, and then he readily agreed to treat my brother-in-law. And then we came here, and then when we met him, he started explaining what the problem is. And so after speaking to him, we realized that not only the ability to pronounce the words, my brother-in-law also lost the ability to comprehend language and then remembering the language and words. And in addition to that, he could not speak and pronounce the words. So when we met Dr. Premnath Garu, we understood that the problem is much more complex. And he immediately started the treatment. And so he also told how much time it will take to get the recovery, in how many phases the recovery will be. And we started seeing results in the first 3 weeks, and we observed that his attention span and then ability to comprehend words has immensely improved in the first 3 weeks of the treatment itself. And so seeing these improvements, so even as a family we also got a little bit energized. So even the patient was very much willing to go to the therapy 2 times a day, each and every day, including Saturdays and Sundays. So earlier, the patient was refusing to go to speech therapy because he did not feel that there is a benefit. But when Premnath Garu started speech therapy, he got motivated. And one thing with Dr. Premnath Garu is that he gave a psychological support, and he gave a hope, and he understood how to deal with the patient. And it is not just speech therapy. So the patient of stroke generally loses a little bit of confidence, and then he loses hope, particularly when a lot of time passes and then there is no improvement. But he understood that that aspect of the patient is also very important in recovery. So it is like he did he had put an extra effort in that regard. And so it has been 8 months now. My brother-in-law can speak almost each and every letter in Telugu language and English. And so he can speak a lot of words, and I'm thinking he will soon be able to speak sentences. And